Assalamualaikum and hi everyone. My name is Fatin Sharti binti Abdul Hamid. My student ID is 2023817298. For subject MRD515, I will present to you guys about breast carcinoma. Do you guys ever heard what is breast carcinoma is?
No.
No.
If not, I will tell you guys right now. Breast carcinoma is the most common cancer in women and the second leading cause of cancer-related deaths worldwide. Breast cancer often begins in duct cell, which is we call ductal carcinoma, or lobules, where is we call lobular carcinoma. Screening programs in Western countries will detect breast cancer early, but meanwhile, in developing countries, it is often found due to symptoms like lumps or nipple changes. The diagnosis for breast cancer include physical exam, imaging procedure, and biopsy. And the treatment options are surgery, chemotherapy, radiation, hormonal therapy, and immunotherapy. But this treatment is customized based on cancer type, stage, tumor markers, and genetic characteristic of the patient. Now we move to its etiology. For now, there is no official statement or research that state what are the main causes of the breast cancer. But there's a few significant factors that influence the probability of getting the breast cancer. The understanding the factor that increase breast cancer is important for women health screening. Age is a significant factor, with breast cancer risk rising as women get older. And gender also play a big role, as most patients that get breast cancer is women. A history of cancer in one breast raises the likelihood of cancer in the other breast also. Certain tissue abnormalities found through biopsy, such as lobular carcinoma in situ (LCIS), can also increase risk. Other than that, family history and genetics also play strong roles, as women with a close relative who has had breast cancer are 2 to 3 times more likely to develop it, and specific gene mutation like BRCA1 and BRCA2 significantly heighten the risk. Other than all that I have said, reproductive factor that increase lifetime estrogen exposure, such as early menstruation, having a first child after age 30, not having child, and late menopause are linked at higher risk. Additionally, the use of estrogen and progesterone for contraception or hormone therapy, as well as factors like radiation exposure, environmental influences, obesity, and excessive alcohol consumption are all associated with a greater likelihood of developing breast cancer. Okay, now we have learned briefly about the breast carcinoma and what is the factor. But have you ever wondered what is the sign and symptom that we should take note of? Do you guys know? Farah, do you know?
No.
Okay, so if you don't know, I will tell you guys. Sign and symptom of breast carcinoma can include, first one is lump or thickening in the breast or underarm. Often the first sign, this lump is typically hard, painless, and has irregular shape. It can appear in the breast or underarm area and is generally immovable. Second, change in breast shape or size. Any noticeable change in the shape, size, or contour of the breast that was not present before can indicate changes within the tissue. Third, skin changes on the breast. The skin may look dimpled or have texture similar to an orange peel, which can be a sign of inflammatory breast cancer. Four, we have nipple changes. The nipple may become inverted or pulled inward or experience unusual discharge, especially if the discharge is clear or bloody. Fifth, we have redness or scaling. The skin around the nipple or on the breast may become red and flaky or scaly. These changes are often mistaken for an infection or skin irritation, but can sometimes signal breast carcinoma. Six, persistent breast pain or discomfort. Although breast pain is less commonly associated with cancer, ongoing pain in one area of the breast that doesn't subside can be a symptom. Last but not least, swelling or enlarged lymph nodes. Swelling in the breast or underarm area, particularly in the lymph node, can be indicate that cancer has spread to the lymphatic node, lymphatic tissue. But not all of the symptoms necessarily mean cancer. But any unusual persistent changes should be checked by a doctor for early diagnosis and intervention. To confirm the diagnosis of having breast carcinoma, there's a few imaging modalities that we can use to detect breast cancer. Each modality has its own pros and cons. So without further ado, let's jump into it. Firstly, we have mammography. The advantage of mammography is mammography can detect early if there's any tumor in the breast. And this mammography has a high sensitivity, so it is effective in detecting the small tumor that might not be felt during the physical exam. This mammography also will reduce mortality, so it can lower breast cancer mortality rates. Mammography also is widely available and relatively affordable, making it suitable for routine screening. This mammography also is low radiation exposure. It has low radiation exposure, so it will minimize the risk of being exposed to the radiation. This mammography also is non-invasive and quick procedure, allowing routine screening with minimal discomfort for the most people. Limitation for mammography. Mammogram can sometimes indicate cancer when none exists, that lead to unnecessary follow-up tests and added anxiety to the patient. It also can cause false negative, which is it might miss some cancer, especially in dense breast tissue, potentially delaying the diagnosis. Mammography also less effective in younger women or those with dense breast tissue where abnormalities may be harder to identify. This mammography also may detect slow-growing cancer that will not have caused harm that end up resulting in overtreatment. This mammography also might be a little bit discomfort as the breast compression during the procedure can be uncomfortable or painful for some women. Next, we have ultrasound. The advantage of breast ultrasound is, first one, ultrasound work well in detecting abnormalities in dense breast tissue, where mammography may be less accurate. The second one is ultrasound has no radiation, as ultrasound use sound wave instead of radiation, making it safer for repeated monitoring and particularly for younger or high-risk women. Then, this ultrasound can effectively distinguish between fluid-filled cysts and solid masses, aiding in accurate diagnosis. Ultrasound also painless, non-invasive, and does not require breast compression, making it more comfortable than mammography for most patients. If we have pros, of course we have the cons. So the limitation for the ultrasound is ultrasound may miss very small or early stage of tumor and limiting its usefulness for early detection. Then the ultrasound also operator-dependent result, as the accuracy of ultrasound depend heavily on the skill and experience of the doctor that use it, which can lead to the inconsistency. Ultrasound also have a high rate of false positive, as ultrasound often detect benign abnormalities, leading to potentially unnecessary biopsy and increased patient anxiety. Ultrasound also less effective as a primary screening tool, as it is generally used as supplemental tool rather than a primary screening method. So breast ultrasound serve as valuable supplemental tool in breast cancer diagnostic, especially for women with dense breast tissue, but it has limitations that make it less suitable as a standalone screening method. Last but not least, we have magnetic resonance imaging, or usually called as MRI. The advantage of MRI is highly sensitive and can detect small breast cancer that may be missed by mammography or ultrasound, especially in the dense breast tissue. MRI also provide a clear 3D image of breast tissue allowing for detailed examination of suspicious area. MRI also particularly helpful in detecting invasive lobular carcinoma, which can be difficult to identify with other image techniques. MRI also may reveal additional cancerous lesion in both the affected and opposite breast that other method might miss, ensuring a comprehensive examination. The limitation for breast MRI is first one, MRI is high cost, so MRI is more expensive than other imaging methods like mammography and ultrasound, which may limit accessibility. MRI also has a high sensitivity, which can result in false positive, leading to unnecessary follow-up tests. Some of people cannot undergo MRI due to claustrophobia or the presence of metal implants such as pacemaker or other incompatible device. So it is not suitable for all patients. MRI also take longer procedure time because the scans will take up to 1 hour compared to mammography or ultrasound. And the procedure requires patient to remain still in the enclosed space, which can be uncomfortable for the patient. MRI also is less effective at detecting microcalcification, which can be an early sign of certain type of breast cancer, making it less comprehensive on its own. So in summary, while breast MRI is highly sensitive and effective in certain cases, its limitations include cost, accessibility, and the risk of false positive, which make it best suited as complementary tool rather than a primary screening method for breast cancer. Hence, among the three of the imaging modalities that I have explained just now, the best modalities to detect breast cancer is mammography. We move to the complication. After treatment, the cancer may recur in the same breast or nearby tissue. Local recurrence can lead to further surgery or radiation. We also can the other complication is metastasis, whereas breast cancer can spread to other part of the body, commonly the bones, lung, liver, and the brain. This progression is often fatal and complicates treatment, shifting the focus to palliative care in many cases. One of the complication is also limb edema. This complication can occur after the lymph node removal, causing swelling and limited movement in the affected arm. Last but not least, treatment complication. Chemotherapy and radiation can cause systemic effects such as cardiotoxicity, neuropathy, and radiation-induced fibrosis that will impact quality of life. Just now, I already explained the modalities that we can use to detect breast cancer. So now we will see the radiographic image that use each modality that I stated just now. The first one is radiographic appearance using mammography. These images are of a 70-year-old woman who felt a lump in her breast. She was diagnosed with lobular carcinoma left breast. So this is her left breast, and this one is the pectoral muscle. The black one is fat, and this like string one is the granular tissue. This one her nipples, and the like circle white circle in the red mark is the tumor. Next we have radiographic appearance using the ultrasound. These images are of a 50-year-old woman who felt a lump in her breast. The ultrasound finding are this woman have hypoechoic mass with an irregular shape. As you can see here, the one that I have marked with pen, the red mark, these white spots are calcification, or other words we can identify as cancer. And this is the radiographic appearance using MRI. This image on the left show a large abnormally enhancing area in the left breast. This was a large invasive ductal carcinoma, as you can see here. Just like the first one I have labeled, this is like the granular tissue, the nipples, and this is the pectoral muscle. And this one, the white in the red circle is the tumor. After seeing that, now let's jump to the technical consideration. As I have said, the best modalities that we can use is mammography. when performing the mammography, there are a few technical considerations that we must be aware of. The first one is exposure setting. Correct exposure setting in mammography are crucial for getting clear image while keeping radiation low. Most machines automatically adjust for breast density and thickness. Lower energy X-ray improve contrast for soft tissue, and slightly higher energy might be used for dense breast. Regular quality check ensure the machine stay accurate, producing consistent image and minimizing radiation. The second one that we should be alert is patient positioning. It is essential to position the breast correctly on the mammography machine. In order to prevent overlooking any possible anomalies, this involves aligning the breast tissue to capture the entire region, particularly along the chest wall. We also need to take note that screening mammograms are performed in at least two standard views. First, which include the craniocaudal view, CC, and the mediolateral oblique, MLO. So we must position the patient correctly in order to get this view. Finally, my presentation has come to the end. Let's recall everything that I just explained to you guys. Globally, breast cancer is the most prevalent cancer in women and the second common cause of cancer-related mortality. Hormone therapy, reproductive history, age, family history, genetic mutations such as BRCA1 and BRCA2, and surrounding are all significant risk factors. Breast lump, nipple discharge, skin changes, breast size changes, and enlarged lymph nodes are some of the symptoms. Each screening technique, such as mammography, ultrasound, and MRI, has its own benefit and it will aid in the disease diagnosis and treatment. Based on the type, stage, and genetic profile of the cancer, treatment options are chosen, including hormone therapy, immunotherapy, radiation, chemotherapy, and surgery. That's all from me. This is my reference. Okay, thank you.